Hello, my name is Rena. Today I'd like to speak to you about somnipathy. Somnipathy is a medical disorder of sleep. I'd like to present to you 4 different disorders, including narcolepsy, sleep apnea, insomnia, and parasomnia. Narcolepsy is characterized by excessive daytime sleepiness. Patients tend to present with an abnormality in REM latency. REM latency refers to a period between just falling asleep and when REM begins. On average, an individual with REM latency of about approximately 90 minutes, but in a narcoleptic patient it could be less than 10 minutes. It includes sleep attacks, cataplexia, sleep paralysis, and hallucinations. How would you treat a narcoleptic patient? In most cases, medication is avoided, but if it's absolutely necessary, then psychostimulants are used. And if the patient is cataplexic, then antidepressants would be necessary. Next is sleep apnea. Sleep apnea is characterized by a cessation of airflow through the nose or the mouth during sleep. These patients tend to snore very loudly, and there would be a pause followed. These patients tend to be overweight, middle-aged men. These patients complain of tiredness throughout the day, as well as having dry mouth, headache in the morning, and they're at increased risks for arrhythmias, pulmonary hypertension, hypoxemia, as well as sudden death. Sleep apnea is divided into 3 different types, which include obstructive sleep apnea, which is muscle atonia of the oropharynx, nasopharynx, as well as the tonsils and the tongue. Also, there is central sleep apnea, which refers to a decrease in respiratory effort. And finally, there's mixed sleep apnea. In this case, there is central sleep apnea for a prolonged period, which leads to collapse of the airways. The treatment for sleep apnea includes positive nasal airway pressure, as well as weight loss and even surgery. Next is insomnia, which refers to a patient's difficulty in falling asleep or even maintaining sleep. Frequently, it's associated with anxiety. Many of these patients have an underlying psychological issue, which may be post-traumatic stress disorder, obsessive-compulsive disorder, or even eating disorders. Hence, it's commonly seen among women. These patients would present with frequent yawning, tiredness throughout the day, as well as the inability to function. Treatment for insomnia includes a good sleep routine, which means the patient would be advised to wake up at a certain time regularly, as well as avoid stimulants in the evening. If medication is necessary, then benzodiazepines are the drug of choice. Finally, it's parasomnias. Parasomnia is referred to nightmares, night terrors, sleepwalking, and sleep talking. These disorders are characterized by the different stages of sleep that they appear in, as well as their different characteristics. And most of them are not treated unless it's absolutely necessary to keep the patient safe, as in sleepwalking. Sleepwalking is present during the 3rd and 4th stages of sleep, and hence you would use a suppressant of the 3rd and 4th stage of sleep, which includes benzodiazepines.